With hormones, there's been so much focus on sexual dysfunction and bone health and muscle protection, and there really hasn't been that much discussion about brain health. And I think that even in the literature, we see very little discussion about hormones. A lot of discussion about drugs, a lot of discussion about the fact that cognitive decline is inevitable. You can't do much about it. It's in your genes. If your mother had it, your father had it, your brother had it, you're going to have it yourself. But I think that we really should open our minds up to the fact that this is simply not the case. We know so much more now that we can affect our genetics. We can affect genetic expression. So I'm going to review a few things that are kind of preaching to the choir. But how many here are here for the first time? That's a lot, So I'll summarize some of these things that those of you who've been to these meetings before have probably heard 1,000 times. But there are certain things that we think are inevitable about aging. And I used to think this myself. I mean, I practiced in clinical medicine in Chicago for 30 years. I was very close-minded about age management medicine and hormones and all this sort of thing. Even as a urologist, I thought, hormones, that should be something done by the endocrinologist. But they don't do it. They don't do it unless you're off the edge high, off the edge low, and unless you really have a disease. And there's really no sense of optimization. But there's a feeling that as we get older, you're going to lose your brain function to a degree. Hormones decline. You get osteoporosis, sarcopenia, sexual dysfunction, loss of energy. And we feel like many of these things are inevitable. And we also feel that probably the one that is most resistant to therapy would be cognitive decline. I don't believe that, and I think there's a lot we can do about it. And I really do, maybe overly optimistically, but I really don't think Alzheimer's needs to happen in the vast majority of situations. I think there's 2 degrees of Alzheimer's. One is a pre-senile dementia, which I think is kind of like type 1 diabetes. You can't, it's a genetic thing, and it really limited what you can do about it. But I think as you get older, kind of analogous to type 2 diabetes, I think the Alzheimer's issue in this situation is really doesn't need to happen most of the time. We know that now 5 million Americans have Alzheimer's. This is going to triple at least over the next generation or so based on current statistics. We know the risk factors that are playing a role here, obesity. These are all common risk factors to so many diseases, but we don't really give as much attention as we should to the fact that it's related to the cognitive function as well. Obesity, diabetes, sleep apnea, hypertension, depression, chronic stress. These are all issues where we're preaching to the choir, and I think most in this room, even those that are here for the first time, are aware of this or they wouldn't be here. But I think we need to think of the brain as a very dynamic organ in the same way we think about the heart and the lungs and our muscle health and our bone health. The brain is very dynamic and reactive to many issues, and reacts to exercise, reacts to nutrition, and I think that we should be really cognizant of the fact that neuroplasticity is really a dynamic process, and even as you get older, as we get into this presentation, you'll see some examples that really got my interest in this going in a remarkable way. But the brain is something that is very dynamic. The hippocampus is the screening area for memory. It's there that we figure out what we're going to remember over the long haul or what we're going to forget. And we know that as we age, the hippocampus shrinks. And we know that neuroplasticity can be affected through exercise, meditation, gymnastics, just mental gymnastics and good nutrition. Exercise is something that does dramatically increase blood flow to the brain as well as to the muscles and stimulate bone function, sexual function, everything. But the brain is equally important as a dynamic organ. So I think that I had never really myself given much focus on hormones in the brain, because as a urologist we focus primarily on not only sexual dysfunction but just depression and fatigue and just all of the typical things of aging. But I actually had a man from my urology practice who started in our program at age 88, which is the oldest that I'd ever done, and rarely would we start somebody at that age on our program in Cenogenics with hormones and a variety of the aggressive things that we do exercise-wise. But we did. He was a very healthy guy, active, athletic, in good shape. Had a girlfriend and really was doing quite well. Running a business, still CEO of a major business in Chicago. So we started doing our thing in terms of just building up his bone health and his muscular health and focusing primarily on keeping him from getting frail. So in part of our workup, we do the cognitive studies, which affects, there's a number of the 5 major domains that we look at, and I'll focus on that. But here he was actually pretty darn good for a guy that's 88 years old. He was a little low on executive function, even though he was an active CEO of a major corporation. Complex attention, a little low, but still he was doing, I think, better than 99% of most 88-year-olds. So I didn't think that much of it, but we saw him back a year and a half later for his annual reevaluation, and this was his cognitive study. Just off the charts good, and this is not age-related. This is compared to the average population, and that really struck me. I thought something may be wrong. This can't be true. But so we didn't think, we didn't make too much note of this. But he was making major progress in terms of his overall function physiologically, and his exercise capacity increased, and his energy was better. And he was at age 88 now. He was saying that he felt better than he did 30 years ago. So he really was a poster child about how well you can do even as you get older. I mean, there's such a sense that at that point it's too late, but it's really not too late. In the right situations if you haven't crossed that threshold of decline. So here we go, 3 years later. It's like still just off the charts remarkable. So it's one of the best I've ever seen. He just happened in any age group, but he just happens to be 91 years old and feeling better than ever. So this is what really got my attention going. And so I started looking at comparisons on other patients. This is his before the 88-year-old and then 3 years later, which is rather dramatic. I think that's an understatement. So I started looking at this in other patients and thinking about the fact that we are focused so much on screening and preventing heart disease, screening and preventing diabetes, same thing with cancer, same thing with chronic inflammatory changes, but we really don't screen cognitive function. We find it when people start forgetting their, just memory usually is the first thing to go, and just inability to recall facts that they would have been able to bring to the tip of their tongue quickly before. But we don't really think about early intervention. We find cognitive decline after it's really developed substantially. We wait for problems to develop, as we do in so much of the rest of traditional medicine, and then we put them on toxic drugs.